Welcome to Clinic with a Heart. In this video, we'll tell you a little bit about who we are and what we're all about. The seeds for Clinic with a Heart were planted when a team from St. Mark's United Methodist Church went 1,100 miles to Mexico on a medical mission trip. On that trip was Dr. Rob Rhodes, who is the founder and president emeritus of Clinic with a Heart. While they were coming home from Mexico, the team talked about what it was like to be able to help people in need. Then they started talking about the need in our own backyard, right here in Lincoln, Nebraska. What if we had a medical mission at home? The first Clinic with a Heart was held May 19, 2003. So you can tell by our history the clinic is inspired by our faith. This is a place for mission teams to put feet to their belief in serving others. A faith-inspired organization, Clinic with a Heart serves people who are uninsured and underinsured through a ministry of healthcare. Our volunteers provide free healthcare with hospitality, dignity, and grace. Free clinics are nothing new. Whenever there's been a plague, there's been a free clinic. But the modern notion of a free clinic began in the 1960s in San Francisco when Dr. David Smith founded the Haight-Ashbury Free Clinic in 1967 during the Summer of Love. That clinic still exists. The number one reason people do not have insurance is that it's simply not affordable. Remember, affordability is relative to income. It often surprises people to learn that there are over 1,400 free clinics in the United States. Free clinics primarily provide non-emergent care and serve as gap fillers in their community. Those 1,400 free clinics in the United States have a significant impact. 5.7 million patient visits were provided in 2020. Nationwide, 60% of the patients served were unemployed. 85% were uninsured. Free clinics all over the United States are fueled by volunteers. Nationwide, 159,000 people volunteered at free clinics. Clinic with a Heart is a 501c3. This is a type of corporation that is used by nonprofits who provide services in the community rather than making a profit. Becoming a corporation makes a company responsible for its actions in the community. All services are paid for with donations, and this status makes contributions tax deductible. You may be surprised to know that we are funded by generous donors. We do not receive government funding. In 2020, our primary sources of income included 38% of our funding came from individual donations through our website and mail campaigns. 19% of funding came from grant funds, primarily from local funders. 13% of our funding came from mission team sponsors. On nights where a mission team sponsors a clinic, the mission team helps to recruit volunteers, manage the evening's activities, and pays a monthly sponsorship fee. 12% of our funding came from Give to Lincoln Day, and 12% of our funding came from in-kind donations. This includes donated services and volunteer time. 9% of our funding came from special events, including a golf tournament. We did not have an in-person gala this year due to the pandemic, but had a virtual event instead. We call what we do a two-way ministry. This means that Clinic with a Heart, volunteers and staff are ministering to those in need, but they too are ministering to us. Being a part of Clinic with a Heart can transform our own lives as we grow to learn the needs of others in our community and appreciate the blessings in our own lives. Clinic with a Heart provides many services to people in our community. These services include medical, dental, physical therapy, chiropractic, mental health, vision, hearing, and spiritual care. In addition to our general urgent care clinics, we are able to provide our patients with specialty care. These services include allergy and asthma, diabetes, extractions, dermatology, hypertension, orthopedic, and pain management. Each services has guidelines and requirements to be referred into. Clinic with a Heart is different from a lot of safety net providers. We try to eliminate as many barriers as we can for our patients. For our general services, first, we do not qualify patients to be seen, so they don't need to bring proof of income. Second, we don't require identification. Third, all of our care is provided by volunteers. While we do have staff who work at the clinic, volunteers provide the direct patient care. We have several roles in Lincoln's Health Safety Net. We are an entry point for many individuals to get health services and to figure out what they need to do to have their long-term health needs met. We provide urgent, short-term care to patients. We are not a medical home. We are a gateway to many other services, including medical homes, mental health resources, and so much more. We are blessed with many mission team partners. Most evenings we have a clinic. A mission team from a faith community comes to serve. These teams coordinate volunteers for their night and help to fund our work. Our sponsors include 7 churches, a temple, 2 hospitals, and 2 teaching institutions. Our clinic team consists of several volunteers, including licensed providers, nurses, health technicians who help with vital signs, clinic support, interpreters, students from teaching institutions, and staff. Our staff at clinics include our clinic coordinator, our referral coordinator, the clinic assistant, and the director of volunteers. We'll just take a little time now to tell you about who we served in 2020. 89% of our patients were over the age of 19, and most were under the age of 65. In 2020, our volunteers provided 2,703 visits to 1,958 patients, a great accomplishment during a global pandemic. This is a smaller number of patients than in years past. In response to COVID-19, we instituted social distancing practices that limited the number of patients we were able to see. Hopefully, in 2021, we'll be able to rebuild our capacity. 58% of our patients were unemployed. 88% of our patients did not have insurance. When asked, 46% of our patients identified that they would have gone to the emergency room if they would not have been able to come to Clinic with a Heart. 81% of our patients spoke English. 13% spoke Spanish. In 2020, 22 different languages were spoken at Clinic with a Heart. 29% of our patients were homeless in 2020. This included people living on the streets, living with others, staying in hotels, or living in their car. It wouldn't surprise you to learn that most of our patients live in extreme poverty. 71% of our patients had household incomes of less than $16,000. We have moved to becoming an appointment-only clinic. This helps us to have a sense of our patients' needs before the clinic starts, including what languages will be spoken. During the appointment process, we also ask COVID-19 screening questions. If a patient is symptomatic, we can move them to telehealth or help them obtain a free COVID test through a pharmacy. Due to the limited number of staff working in the office, we limit the times we accept calls for appointments. Patients may call us Monday through Thursday after 2 p.m. Once a patient has an appointment, they can complete their demographic and health history information online from our website. If the patient has a barrier to getting the paperwork done themselves, a volunteer will call them and complete the paperwork with them over the phone. Once a patient gets to Clinic with a Heart, they check in and we do a temperature check and make sure the patient is wearing a mask over their nose and mouth. All patients, no matter what service they are here for, will have a full set of vitals done. Once vitals is done, a nurse will review the paperwork that the patient submitted earlier. The nurse will write additional notes on the forms as needed. The patient will then visit the provider. After the provider visit, if a prescription was written, the patient will see the pharmacist. The pharmacist will check the patient prescription to make sure it is on our formulary. They will also answer any patient questions. They'll put a smiley face on the prescription, and the patient can go to any Russ's or Super Saver, and Clinic with a Heart will be charged for the medicine. Next, the patient will meet with the discharge nurse, who will review any instructions or referrals with the patient. If the patient has a referral for additional testing, they will also meet with our referral coordinator. The referral coordinator will help the patient understand next steps. If the patient has a follow-up visit, we call this a fast track and shorten the number of steps for that visit. The patient does not need to do paperwork again or go through intake. Thank you for volunteering at Clinic with a Heart. You are making the difference for many people in our community.